So we're now going to show you the best way to get out of bed. If you have had tummy surgery, then overusing your abdominals can be quite painful. Pain doesn't mean you're doing yourself any damage by any stretch, but this way will hopefully mean that getting out of bed is more comfortable for you. So what Penny's going to do, so Penny's going to bend her knees up first of all. She's going to slightly shuffle her bottom over to one side because we've got a narrow bed, but you might find you need to do this yourself. Then she's going to roll onto one side, and you can pick whichever side you want to roll on, it doesn't matter which side. And then gravity at this stage is your friend. So she's going to wiggle her legs off the end, let them come down to the floor and push up with her upper arms, and then she's up into that sitting position. Give yourself a couple of minutes whilst you're there. Take some deep breaths, roll those shoulders because you've probably been in bed for a little while. And then when you feel ready to, you're going to have a stand up. Now at this point there will be somebody with you at this stage. So if your feet are not on the floor already, you may need to wiggle your bottom forward. And then Penny's going to use her arms to push down through the bed and have a stand up. She's going to need to bring herself forward, so bringing her nose over her knees and then coming up into the standing position. And again, when you're there, just give yourself a couple of minutes, take some deep breaths, and try and stand up nice and tall. We know that if you've had tummy surgery, you're going to want to stand over yourself to protect yourself. But it's much better for you to bring your shoulders back and stand nice and tall. Okay. So we're going to show you now how to get into bed. So essentially, it's the reverse process. So you're going to want to step backwards so you can feel the bed on the back of your legs so you know that it's there. Reach back with your hands and guide yourself down. Now you're going to want to think about your position on the bed. You don't want to be too low down in the bed because once you're then lying down, you're going to be miles away from the pillow. So at this stage, you may need to shuffle your bottom a little bit closer to the pillow. Then in this position, Penny's going to lower her upper part of her body down, come down into side, bring the legs up, lovely. And in this position, you're going to then just have a roll onto your back and make yourself comfortable. Lifting your bottom up when you're moving can be really useful. And again, pain doesn't mean you're doing yourself any damage. Any movement you're going to feel around the area, any discomfort is quite normal, but don't worry. So from this stage, we're now going to show you some tummy exercises that you can start day 1 or day 2 after your surgery, and you'll find these in the resource leaflet at the end of the presentation. Do have a practice of these before you have your operation so that you feel nice and confident that you can do them. Okay, so the first exercise is pulling your tummy in. So Penny's going to rest her hands low down on her tummy, then she's going to pull her tummy muscles in just to feel a nice contraction. Make sure that you're breathing at this stage, and if your catheter is not in place, you can also switch on your pelvic floor muscles. Make sure that you're breathing, taking some nice deep breaths, and if you hold this up to 30 seconds, that will be ideal. Now your second exercise is a pelvic tilt. So again, Penny's going to do the first exercise. She's going to contract the lower part of her tummy muscles, make sure that you're breathing, turn on your pelvic floor muscles, and then she's going to rock her pelvis back so that she's flattening her spine into the mattress. And then she's going to rock it back to your starting position. And you can repeat that again, anything between 5 and 10 times. Again, have a little check, make sure that you're breathing, make sure that your tummy muscles are switched on as well. Now the next exercise are knee rolls. So again, Penny's going to contract the lower part of her tummy, make sure that you're breathing, turn on your pelvic floor if you can, and then with your knees, you're going to slowly rock from one side to the other. You don't need your knees down to the mattress, you just need it to be a nice slow and controlled movement. Left and right. And make sure that your hips aren't coming off the bed too much with this one. And again, 5 to 10 repetitions would be ideal. And if you get a chance to do these exercises once or twice a day, that would be great. So once you're comfortable with those first 3 exercises, you can then start to progress and do some more difficult ones. So this exercise is a leg stretch. So with one leg, again, turn your tummy on, do your pelvic floor muscle exercises and make sure that you're breathing when you do this, so you're using all of your core muscles when you're doing these movements. Penny is then going to straighten one leg down into the bed, and then bring it back up again. And repeat the other side, and again 5 to 10 times would be ideal. So the idea is it's nice and slow and controlled. It's not a race. Now your next exercise are alternate knee bends. So Penny's going to, again, contract your tummy, pelvic floor, make sure that you're breathing, and then she's going to bring one knee up to her chest, and then back down again. And repeat at the other side. And again, just do that quick self-check. Are you breathing? Are your tummy muscles working? Or are your pelvic floor muscles contracting as well? And it's all about using all of your muscles together as a system. Wonderful. Then the next exercise is single knee rolls. So very similar to double knee rolls, but it's just with one leg. So again, contract the lower part of your tummy, pelvic floor, make sure that you're breathing, and then Penny's going to drop one knee down to the side, and then slowly back up again. So it's about 45 degrees out. You don't need your knee down to the floor. And what you're checking for with your hands is that your hips aren't tilting over to one side. They're nice and level, almost like you have a tray of drinks and you're not going to spill them. And again, make sure you're breathing, you shouldn't be holding your breath. And again, 5 to 10 repetitions is ideal. Then your last exercise is bridging. So with this one, again, do your pre-checks. Contract the lower part of your tummy, pelvic floor muscle, breathe. And then I want you to roll your bottom up, so that essentially you're lifting your bottom up. So you can see nicely that Penny was rolling down up through the pelvis, peeling her spine off the mattress, and then she's going to do the reverse. So spine segments touching the mattress, rolling your pelvis down, and back to your starting position. So we'll have that one more time. Lifting your bottom up, peeling up from your spine. Make sure that you're breathing, tummy's away.